Welcome to the Population Council. My name is Jim Saylor, and I'm the interim co-president of the Population Council and the executive director of the Pop Council Center for Biomedical Research located here in New York City. On behalf of my co-president, Pat Vaughn, and myself, I'd like to extend warm greetings to our esteemed guests, which is all of you who are here in person and online. We're particularly honored to welcome Ambassador Noemi Espinoza Madrid, the Minister of Social Development, Jose Cardona, and the rest of the delegation from the government of Honduras. Also from Uganda, the Acting Director General Samuel S. Omwa of the National Population Council of the government of Uganda, and the entire government of Uganda delegation, including representatives and ministers from the Ministry of State for Finance, Planning, and Economic Development, the National Population Council, which is a name I like very much, the National Planning Authority, Parliament, and the Senior Presidential Advisor on Population Issues. I want to thank our panelists from UNFPA and FP 2030, our moderator, who I will introduce shortly, and the co-organizers representing Women Deliver, Panorama Global and YLabs. We find ourselves in an invigorating moment to revisit the promise of the 1994 International Conference of Population and Development in Cairo, when 179 countries came together to agree on a program of action, putting rights at the center of conversations of global development and pledging that the needs of women and girls should be prioritized. Thanks to the Cairo conference and the work of literally hundreds of thousands of people since, we have made substantial progress in achieving this goal. I'm going to offer just 2 data points that support that. The first is that we have multiple new methods of contraception, which are less costly and more widely accessible than ever. And by the way, I'm proud that several of those methods were developed by the Population Council. And the data point is that there are twice as many women now using a modern method of contraception today as we had in 1990. That's progress. We have also made tremendous progress in understanding the science of reproductive health. And in many places, we've reduced maternal mortality and morbidity. Between 2000 and 2015, we saw a 33% decline in maternal mortality. That's also great progress. But universal access to sexual and reproductive health and the active promotion and protection of sexual and reproductive health and rights have not been fully realized. As we grapple with fallout from anti-rights movements globally, we sit today with sobering reminders that reproductive justice is far from this reality, and increasingly so even here in the United States. Fighting for this future is core to the Population Council's mission. And as the world confronts the intertwined threats of the climate crisis, rising inequality, and political instability, we cannot let SRHR fall off the list of global priorities. These issues exacerbate the conditions for the most marginalized populations, including women and girls, and all of their complex and intersexual identities, making it all the more urgent to recommit ourselves to the realization of sexual and reproductive health rights for all. And we must do this explicitly, building out policies across all sectors that strengthen SRHR and gender equality. At the Population Council, we're meeting the moment to tackle these global trends. 6 years ago, we launched our Population, Environmental Risk, and Climate Crisis, or PERC initiative. I'll refer to it as PERC from now on. PERC is now central to the achievement of our strategic plan through 2030, and its goal is to pursue justice in the face of climate and environmental changes, particularly as it pertains to reproductive health and sexual health. And as an organization known for advancing gender equality and sexual and reproductive health and rights, we're committed to advancing climate justice in our work because the climate crisis disproportionately affects communities that have contributed the least to global emissions. Climate change also compounds existing inequities created by historical forces of exclusion, while also creating new inequities and challenges. After all, we all know there's no reproductive justice without climate justice. So how are we integrating a climate justice lens into our research at the Population Council? Well, the first is the recognition that the largest generation ever of young people, 1.8 billion people, is still largely excluded from climate research, negotiations, and policymaking. Through a multi-country-led participatory research study in Bangladesh, Guatemala, and Nigeria conducted with Women Deliver, which Eleanor will present later in our program, we found that climate change is shaping young people's transition to adulthood with widespread harms and concerns, such as school disruption, limited work options, and mental health distress. We also found that climate change is intensifying harmful gender norms, threatening progress in gender equality, women's health, and economic empowerment. For instance, climate-induced crises lead to spikes in child marriage. Economic insecurity from climate impacts can lead to families marrying off daughters to alleviate financial burdens. Through the Girls Resilience Education Empowerment and Needs program, which we call GREEN, we work with an indigenous women-led sustainable agricultural enterprise that grew out of the council's Abriendo Oportunidades, or Opening Opportunities program in Guatemala. GREEN works to prepare girls and young women, including those out of school, to learn key skills to benefit from the growing green economy and become leaders in climate advocacy and policy. Thank you so much for being here with us. You're in for a real treat with this panel. We have an amazing group of experts today who have led work at this important climate reproductive health nexus. First, it is my privilege to introduce Ambassador Noemi Espinoza Madrid to share keynote remarks reflecting on the significance of 30 years since ICPD. The ambassador is the chair of the Commission on Population and Development and deputy head of mission at the Embassy of Honduras in the People's Republic of China. She has close to 30 years of experience working on political advice, advocacy, partnerships, and strategic guidance for top-level government officials and intergovernmental organizations, mostly at the United Nations. She has led intergovernmental negotiations as an ambassador and a UN advisor, and she's known for establishing and galvanizing partnerships with civil society and governments to advocate for development, human rights, and for political, economic, and cultural justice. The ambassador is a sought-out lecturer for academic conferences and universities. She began her diplomatic career in the Honduran consulate right here in New York City in 1996. The ambassador has served in various capacities at the Permanent Mission of Honduras and has a long career in the United Nations Secretariat, where she has been a senior advisor to the UN President of the General Assembly and a special advisor to the Secretary General's Envoy of Youth. Welcome, Ambassador.
Thank you very much for that very kind and generous introduction. And as I was listening to your opening remarks, I reflected that we have a lot of the same talking points. So it's good that we're on the same page on the issue. So I apologize in advance for repeating some of the points, but not all. I do have new things to say. So once again, thank you very much. I'm honored with my Minister of Social Development here, His Excellency Jose Cardona. And thank you all. It's a pleasure for me to be here today. I celebrate holding this event because it brings to the table a highly important link between topics that are very significant for the population and development agenda. In my capacity as chair of the 57th session of the Commission on Population and Development, I have pointed out that we are living key moments in history. The moment is undoubtedly marked by the climate crisis that is deeply intertwined with gender equality and sexually reproductive health and rights. Understanding that the climate crisis is not only an environmental challenge is essential. The climate crisis reveals a profound social injustice because it affects more its effects are more deeply felt by people in the most vulnerable conditions. If we add to this a series of structural, social, and economic factors that cause the persistence of gender inequalities, it then triggers a series of long-term consequences that disproportionately affect women. Therefore, we must underscore the interdependence between environmental sustainability and gender equality as a matter of urgency. Allow me to mention at least 3 examples of how climate change affects women's lives. Number 1, traditional gender roles become exacerbated during situations of natural disasters and displacement, and they tend to increase our responsibility of household and care work, thereby limiting the opportunities for education and employment, which in turn leads to a perpetuation of cycles of poverty and inequality among girls and adolescents. Additionally, climate emergencies increase gender-based violence and child marriage. This is the talking point that is being repeated. Number 2, health services, including sexually reproductive health services, are generally interrupted during disasters. This leads to consequences such as an increase in unplanned pregnancies, complications in pregnancy and childbirth, and a reduction in the availability of and access to contraceptive methods and other essential services. And number 3, economic hardship becomes more acute. Women tend to have less access than men to vital resources such as property, money, and education. Their jobs generally belong to economic sectors that are highly vulnerable to the impacts of disasters and they are in informal conditions, meaning that climate disasters and displacement make women's already precarious economic situation even worse. As I said at the beginning, putting this issue on the table is fundamental to raise awareness, strengthen dialogues, and most importantly, develop actions to confront climate crisis and its consequences. These actions must consider the specific needs of women, girls, adolescents, and elderly women. We must ensure that intersectionality is taken into account. That is, we must consider the multiple identities that interact in complex and unique ways, and that unfortunately translate into various forms of inequality and discrimination that intertwine and affect people both individually and collectively. We must also act from a holistic approach that considers climate mitigation and adaptation strategies with a gender perspective. To face this crisis, we must work to build communities that are truly resilient to natural disasters and integrate social justice and gender equality in all phases of disaster management. Doing so not only ensures meeting the needs of all people, but also contributes to strengthen the capacity of communities to face future challenges. With this complex scenario that hinders our present and compromises our future, having an effective multilateralism that truly responds to our needs is crucial. This is a great opportunity. The 57th session of the Commission on Population and Development is underway. The ICPD Program of Action is celebrating its 30th anniversary, and next September we will have the Summit of the Future. All of these are of great relevance, because in these intergovernmental spaces where the decisions that impact people's daily lives are made. The ICPD Program of Action is a milestone because it proposes changing the way in which we envision development. This ambitious agenda emphatically states that rights are at the center of sustainable development, which has forced us to think and work to achieve a development that guarantees the full exercise of human rights, equality, and dignity for all people. It has been proven that demographic factors, together with poverty, the lack of access to resources in some regions, and consumption and production patterns cause or exacerbate issues of environmental degradation and resource depletion, and therefore impede sustainable development. This is why the population agenda must be a cross-cutting agenda. The Summit of the Future is an essential platform to continue along the path of international consensus and commitments to safeguard the future. From my perspective, the population agenda needs to be part of the outcome of the Summit of the Future. There is no doubt that accelerated and full implementation of the ICPD Program of Action offers a solid foundation for a better present and a sustainable future. Being a spectator, doing nothing, or maintaining the status quo is no longer an option. Every day spent in inaction is not only harmful, it also comes at the cost of lives. As I pointed out, our decisions in these intergovernmental spaces have an impact. A kind of impact they have, and the kind of impact that they have is up to us. Let us ensure that the impact is positive and that we move forward together into a world with a just, equitable, and sustainable future. Once again, I appreciate having been invited to this space, and I am grateful for an opportunity to highlight the interconnection of the population agenda, the climate agenda, and gender equality. I thank you very much.
Well, those are excellent talking points. I'm glad we agreed. You know, it could have been much worse if we started arguing with each other in the introduction to the session. I'd now like to welcome our moderator, Acharya Mohammed Smith. Acharya is a philanthropy advisor for Geneva Global. She brings over 15 years of experience in the philanthropic sector, having started as a youth philanthropist, facilitating connections between next-gen youth and youth activists. She now serves as a philanthropy advisor supporting giving through an intersectional lens with a focus near and dear to our hearts on gender equity. Over to you, Acharya, and I give you the symbolic microphone. Here you go.
Thank you so much, Joe. So before we dive into our panel conversation for today, I would like to begin by acknowledging that for those of us that have the privilege of being gathered today in person, that we are sitting on the traditional lands of the Lenape and Mohican Indigenous people. And by recognizing this, we open up the opportunity to pay respect to the elders of this land, both past and present. So thank you for that. And as previously stated, my name is Acharya Mohammed Smith, and I'm very excited to be moderating our panel for today. So let's hop right into introductions. Sitting closest to me, we have Samuel Omwa, the Acting Director of the Government of Uganda's National Population Council. Next, we have Patricia de Silva, Program Advisor to the People of African Descent Initiative within the Policy and Strategy Division of UNFPA. Next to her, we have Pamela Garcia, FP2030 Senior Advocacy Advisor with focus on Latin America and the Caribbean. And next to her, we have Rajib Acharya, Senior Associate at the Population Council. We'll also have the privilege to hear from Eleanor Blomstrom, the Acting Director of Policy and Advocacy at Ag.Deliver, and Nicole, Ippoliti, Technical Director at YLabs, on some of the research and work that their teams are doing. So to kick it off, I'll start with you, Rajib. And as the SRHR Research Lead at the Population Council, how are you working to incorporate climate into your research agenda? And what advice do you have for other researchers in the SRHR space to start infusing climate considerations into their work? Actually, I think for the folks. Yeah, you can ask.
Thank you, Acharya, and on organizers of the UNFPA, Panorama Global and YLabs, for giving me this opportunity to speak in this August forum. Thank you for your question, Acharya. As you know, the Council has been leading leader in generating evidence of sexual and reproductive health and rights for more than 7 decades. And most recently, I've started, as Jean mentioned, the PARC initiative that has started gathering evidence on impact of climate change, SRHR, and other health areas, as well as in other areas like education, like well-being of young people, and many other things. I will give you 4 direct examples of our works that are directly related to SRHR, and while you hear from others on the other work that we have been doing in collaboration with UNFPA. First, published in the midst of COVID-19 pandemic, our review of 13 studies available at that time, more now, asserted that across countries, extrinsic events, either natural or man-made, worsen the availability and women's access to SRH services, and it largely ended up in decreased utilization of services, including lower use of clinical family planning methods. This often meant that increase in unwanted pregnancy, shorter birth intervals, and also increased instances of low birth weight babies. Second, our primary qualitative work in Zambia found that the extended drought in rural Zambia increased the food insecurity and economic instability, making particularly women-led households vulnerable. As droughts increase the stress of both earning income and caregiving, leading to an increase in the early marriage and reproductional sex. Poverty stemming from drought led to school dropouts, early entry into workforce, early marriage. It also changed women's fertility preferences. Women now who wanted 6 children, for example, started wanting much less number of children, thereby increasing the demand for long-acting family planning methods. You know, on the side of this, there are also research, not from Pop Council, from other researchers, that increased heat exposure can actually decrease the fecundity among both males and females. That's another health issue. This is not directly our research, but our other papers research. Third, our research also revealed the increased salinity in groundwater in Bangladesh was associated with increased blood pressure and hypertensive disorders during pregnancy. And you know, this is the leading cause for maternal mortality and morbidity. And the presence in arsenic in groundwater in India was associated with increased maternal health issues, infertility, and pregnancy problems in the country. As you may know, only 1 minute. Bangladesh is a low elevation coastal zone, very much, susceptible to flooding of saline water into the land. So that is there. So Bangladesh and more than 1 billion people are always going to have similar problems. And then finally, in Pakistan, there's a unique study on the aftermath of massive flood in 2010, and that showed that there's accelerated several demographic shifts. For example, in migration from rural to urban areas and those. In council, we started talking about, Chelsea Police and I lead the SRHR portfolio of the council. And when we started to make a research agenda for the council, we started talking to many other colleagues across the world, within council and outside. And not to our surprise, we expected that everybody mentioned climate and SRHR, the intersectionality, as one of the top things that we should look at. So that is, of course, in our research agenda. So we also brainstorm many ways that we can contribute to this intersectionality, and I'll give you some examples. Thoughts were expressed by the colleagues from our Center for Biomedical Research on developing technology and mechanisms for self-care products that may beat the effects of climate change and on a facility-based services. There are further thoughts on developing biomarkers to measure different kinds of exposures, for example, exposure to environmental toxins. Okay. Finally, given the council has a strong background of developing measurement scales, for example, experts from council also are thinking on developing new measurement scales for understanding these climate and SRHR linkages. So these are only few of the many thoughts that we are having currently at the council. Thank you.
Thank you. Thanks for sharing about how your team is incorporating climate into its research agenda. Next up, we'll go to Patricia. And the UNFPA published a brief last year titled, "In Your Own Words, Voices of Women of African Descent for Reproductive and Climate Justice," which took a look at how climate, racial, and gender justice are interlinked. The brief centers the experience and recommendations of women across the globe. So can you share with us some of the key analyses and recommendations and how you see this linking to the 30th anniversary of the ICPD and the promises therein?
Yes. Thank you, Gara, for your question, and good afternoon, everyone. It's great to be here also with this great group of panelists. So what has already been alluded to here, and I'm not gonna probably spend a lot of time on it, is that climate change really has a negative impact on access to SRHR, including UNFPA's 3 transformative results. So our analysis has indicated that it disrupts, as you've been said, maternal health. Vulnerable situations, and like it was mentioned before, sometimes are offered into early marriage for different reasons. So taking this into consideration, this 30th anniversary of the ICPD, really what we want is to strengthen our commitment in the recognition of the data that we've been discussing here, that there change affects everyone in this room, everyone in the planet. But it really has a disproportionate impact in populations that are already marginalized, historically marginalized, including people of African descent, but also indigenous peoples and others. These are populations that often live in what we call fence line or sacrifice zone. With the existing inequalities that they are already facing. They often are already impacted by social, political, economic oppression, which is often rooted on legacies of colonialism and slavery, as it was also mentioned here today. So when we come you are gender non-conforming, would you go to a shelter? Is it safe for you to be there? Probably not. So you might end up being homeless or living in the streets. So these compounded effects of the climate crisis on women and girls of African descent really reduces their ability to respond to the climate crisis, to ensure their health and well-being, including sexual health and rights. And this also often leads to intergenerational poverty. We're talking about women when children of African descent are around 5 times more likely to suffer from asthma due to the environmental issues. That means a lot of mothers have to stay home to take care of their children when they're having this crisis. That means a loss of income, right? So it continues to really this system of intergenerational poverty. So in our advocacy brief, it's called In Our Words, Voices of Women of African Descent for Reproductive and Climate Justice. I always say it all, by the way. In addition to what we've just been talking about, our partners also raised other issues. They raised concerns related to violence against women rights defenders, against women rights activists, the disregard for ancestral and historical heritage, issues related to land rights, where they're not often are not allowed to own the land that they leave, or even sometimes are forcibly removed from those lands, which really causes a great effect on their lives and on their livelihood as well. In addition to the data, by the way, for this brief, we also use what we call storytelling. So our partners really told their lived experiences around mitigation and adaptation to climate crisis, and they were incredible stories. Like in Haiti, we know when there's floods and family planning supplies get stuck, and like more and more women get unintended pregnancies because they don't have access to family planning, or the disproportionate vulnerability of young girls to this climate crisis because of the loss of security, etc., etc. So in terms of recommendation, there are many, and I really invite you to go and Google our publication. But we focus on things like ensuring that the leadership and the expertise of people of African descent and all other communities that are affected really are encouraged in responses to climate change and design to address climate crisis, right? These are communities that are living these experiences. They have been for many years. Often enough, they have really innovative ways to respond to these emergencies. So this knowledge needs to be recognized and amplified. Of course, strengthens research and data. We keep talking about research and data, participatory ways, data and evidence and research that is driven by communities based on what really their needs are at the community level. Of course, strengthening climate adaptation, just transitions, and resilience efforts, specifically and intentionally targeted to those communities. Yeah, and I think it's the intentionality really that makes the difference, right? You do a lot of what we call mainstreaming, everything, but in that we a lot of things fall to the cracks, a lot of people, a lot of communities fall to the cracks. So we need to be intentional in this design that are addressing the needs of those communities. Of course, increasing representation at all levels, including global decision-making spaces. I think this was also discussed, the COPs, and etc., but also at the national and at the regional level. So they need to be sitting at the table and be part of the solution design. My favorite, consistent, flexible funding that addresses the concerns of those communities. I call it no shenanigans funding because we really have to make it easy for these communities to get access to these funds. I know how many of you have ever written a grant. I mean, it's like insane, takes a long time, it requires so much technical expertise. We really need to make it easy for communities at the local level to have access to these funds and be able to respond to their climate crisis needs and their environmental emergencies. And so I don't know if she said one that did not, but I'm almost going to. I just wanted to mention that in our SWOP report, State of World Population report this year that was focused on inequalities, we talked about issues of inequalities and really that we cannot achieve the SDGs, the 3 transformative results, the ambition of the CPD if we do not specifically and intentionally take into consideration the growing inequalities that we are facing. But I think it's more important, and to end on a hopeful note, it is possible. And if we work together and we harness our collective efforts, we really can build a more just and more equitable world for everyone. Thank you. Thank you.
Up next, I'd like to invite Eleanor from Women Deliver, and the Population Council and Women Deliver recently facilitated youth-led research related to the climate crisis. Could you share some of those key findings with us? And as one of the co-conveners of the SRHR and Climate Justice Coalition, could you tell us how the coalition engages at the intersections of SRHR and climate?
Okay, great. Hi, everyone. Thanks so much for coming and joining us here. It's really great to see a full room and people interested in this topic. And so even if you hear us repeating ourselves, again, you'll see clearly that there's still a lot of work to be done to have any action follow up on these the points that we're making today. So I just wanted to briefly walk through this research that happened last year, and it specifically focuses on adolescents and young people. And I think one of the things that's important to know is we're seeing cascading impacts, cascading harms on adolescents and young people. Everything is just adding up. So, you know, those of us who are in middle age or even young adults, you know, in your 30s, we haven't experienced nearly as much as they will. And there's an expectation of a 7-fold increase in extreme events on people born in 2020 compared to 1960. So it's pretty huge. Next slide, please. So we also have seen that there's not been much research that's actually looking at the impacts on adolescents and young people, and certainly not on what their opinions are and their perspectives. So what is the best way to understand that? It's really just to ask them. And so the purpose of this research was to do focus group discussions and to understand what they're thinking. Next slide. So I wanted to share the methodology. I think it's a really interesting methodology and is a good starting point to start to understand, especially in really highly impacted climate areas, how young people are experiencing these things. And they're not necessarily young people who are activists and working in climate or working in social justice or nonprofits. They're regular people, their ages 12 to 25 that participated in this. And what was also exciting about it is that it was an opportunity for young people who are working sort of in this movement space, in the gender equality space, to learn from researchers. So there's a young leader program that Women Deliver has, and several of those young leaders worked with researchers from Pop Council to design this study, to come up with the focus group discussion questions and really learn how to do the research through their own participation. Next slide, please. And there were lots of results coming from this. We saw impacts on health, education, changing gender norms. I think, as the ambassador had said in the beginning, really does impact that migration patterns internally, externally, and also economic impacts. I wanted to focus on the SRHR impacts clearly. So this slide looks at a few of the broader health impacts that were somewhat different between the countries. And Bangladesh on waterborne diseases because of the rising salinity we've heard about. In Nigeria, there were issues around heat and infectious diseases. And in Guatemala, the expansion of palm oil plantations, which kind of interacts with climate changes and monocultures to really cause damage to the environment. Next slide, please. So in terms of adolescents and young girls, 3 main areas came out from their answers: child early and forced marriages and unions, menstrual health impacts, and gender-based violence. And all of this, of course, links to that eco-anxiety and the mental health issues that many young people are facing, the sort of existential, what does my future look like? This is a picture from the Bangladesh, one of their focus groups there. Next slide. These are a couple stories, and I think it's interesting. If you read them, it almost sounds like the people who gave the quotes are saying the girls had a choice in this, but really it is no choice when it's early marriage, when you're trying to flee because you think, okay, this would be a better life for me, or when you move because you're trying to help your family. So this isn't about families sending the girls, it's about the girls making some choices, but again, it is not a choice and it's something we need to avoid. Next slide. In terms of gender-based violence and menstrual health, a lot of these are actually what we've heard already, but you can see how the young people are experiencing it. I think also interesting is with the palm oil plantations, there are many people then coming from outside of the community, leading to increased gender-based violence and harassment. And then in Bangladesh, that many young people were starting to use contraception to stop menstrual cycles to avoid all the challenges due to lack of water and sanitation. Next slide, please. We also heard from the young people that they're taking action, but in this case, that often they were sort of smaller projects, at least those who were involved here. That doesn't mean bigger projects aren't happening, but they also expressed some disappointment in local government's inability to support them with fundraising, guidance, and other structures. They did see potential in social media as an organizing tool, and also particularly in Guatemala to think about how to engage ancestral solutions in agriculture, etc. Next slide. So we've heard some of what's needed, but really more of this research on lived experience, particularly the SRHR of adolescents and young people, and integrating that climate and youth lens to gender responsive health policies and programs, but also gender and sexual and reproductive health and rights to climate policies. I think we might hear more about that from Samuel from Uganda very soon. And also really the importance of comprehensive sexuality education to reduce gender-based violence, foster gender equality, and build that resilience. We know that SRHR is really climate resilience, and of course, shared meaningful decision-making. Next slide. This is acknowledgement of the amazing researchers and a QR code for the briefs that we published at COP last year. And I think we also have outside on the table another QR code that should link to the study as well. So next slide. The last thing I'll talk about, which is very important because I said we need to take action, right? And we need to work together. There are movements, there are so many organizations that are trying to think about SRHR and climate justice together, including the SRHR and Climate Justice Coalition, with over 100 organizations from over 50 countries. You can see on here the kind of work that we do. You can see our 5 principles. I think we've heard them already: the importance of human rights, intersectionality, bodily autonomy, justice, and inclusive organizing. And the important work that comes out of this, it's not only learning sessions where we hear from national partners who are doing amazing work on the ground and what they're experiencing, but it's about taking advocacy strategies and campaigns to COP, to the annual climate conferences, to national governments, and saying, this is what we need to have happen. We need you to take action. You are the duty bearers, we're the rights holders, and it's about bringing those communities together to disrupt the patriarchy and make sure that we are on a path to addressing climate justice and SRHR. Thank you.
Thank you, Eleanor, for sharing your work with us. Next up, we have Mr. Omwa. And my question for you is, Uganda is now in the process of creating a national health adaptation plan, which will lay out plans for how the health system could remain resilient in the face of the climate crisis. Could you tell us briefly about the ongoing process and how you identified the adaptation plan's priorities?
Thank you, Acharya. I stand on the existing protocol. And thank you for the question in terms of how we are moving on with the process of developing the National Health Adaptation Plan. For the beginning, I would like to say I work with the National Population Council, which is the government agency responsible for coordinating the country population policies and programs, and the chief advisor or chief agency that offer advisory services to the President of the Republic of Uganda. The journey of developing the Uganda's National Health Adaptation Plan, I could say, started at during the COP26 processes. And in that COP, there were 2 commitments that Uganda made as a country. One was to undertake a vulnerability assessment and adaptation, which is very critical in terms of undertaking the situational analysis. Having done the vulnerability and adaptation assessment, the next commitment that we made as a country was to come up with the National Health Adaptation Plan. Now, for the start, I would want to submit that the process has been iterative, but principally, when we made this commitment and we undertook this, the vulnerability, the National Health Climate Change Vulnerability and Adaptation Assessments, the outcome directed us towards developing a National Health Adaptation Plan. Of course, the goal of the plan is to make sure that we strengthen the adaptive capacity and the health system to climate change and related hazards. And of course, we undertake this through we had an extensive stakeholder consultation. The issue of climate change, climate stability is a multi-sectoral process. So in order to galvanize consensus in terms of our assessment, our strategies and priorities, we had to undertake an extensive stakeholder consultation. We involved both the ministries, departments, and agencies of government, the civil society organizations, the academia, in terms of the development process. Having done the vulnerability assessment and adaptation assessment, we based it on the World Health Organization framework. And based on the assessment and under each of those pillars, we came up with the priorities. What were the issues that we want to address to make sure that our health system becomes resilient or is resilient to the climate hazards or climate change effects. Of course, now to address that or to guide us that's where we now come up with our adaptation strategies. So in this sense, what informed our national health adaptation plan was the vulnerability assessment. And then after the vulnerability assessment, we undertake extensive stakeholder engagements. Out of that, we came up with the priorities interventions. Having identified the priorities, then we came up with the adaptation strategies. Just to highlight some of the few priority areas of our intervention, one is the issue of leadership and governance. We realized that for us to confront the challenge of climate change, we need to have a robust leadership that responds to emergencies that climate change exposes us through. So that means we need to have structures right from the national up to the grassroots level. And some of these governance structures, you don't need to, we already have quite an elaborate governance structure in the country. There is already a climate change kind of coordination mechanism at the national level. This is also reflected at the sub-national level and whereas at the village level. At the village level, you have various structures. So in our case, we have what we call the village health team. These are now the frontline workers who interact with the communities in addressing some of these challenges. So the next one, of course, is the health workforce itself. Our priority interventions also focuses on the health workforce. And specifically in terms of building their capacities, creating awareness between the linkage between climate change and then the intersection between sexual reproductive health rights and needs and services. So it's very vital for us to build the capacity of the health workforce so that they understand what are these climate risks we are talking about, what are these vulnerabilities we are talking about, and what are the adaptation strategies that we must make sure it's integrated into our responses. Of course, this is embedded within the overall risk, integrated risk management framework. Just to reflect on, Uganda has had a number of disasters. Of course, we know climate change has exacerbated this. And of course, we also had a couple of epidemics. We dealt with Ebola, we dealt with COVID-19 and others. So this has enabled us to put in place some risk management framework. So the National Health Adaptation Plan builds on this to put in place a much more integrated risk management framework and coordinated in a multi-sectoral way. And for this, we have Ministry of Office of the Prime Minister, Ministry of the Office of the Prime Minister, the Department of Disaster Preparedness, and you have the Ministry of Health, the Ministry of Local Governments, and Ministry of Water and Environment, all coming together to make sure that there is a robust risk management framework in place. Of course, as we talk of the National Health Adaptation Plan, the idea of research becomes critical. We know the challenges that confront us keep on evolving, and we need to continuously generate new bodies of knowledge. So the National Health Adaptation Plan prioritizes research, especially linking this into the issue of sexual and reproductive health and gender-based violence. The idea is to gather that body of evidence, that body of knowledge that could enhance our intervention, the adaptation strategies, as well as the advocacy. Of course, when it comes to climate change and climate stability, most of the things that get affected are the infrastructures, both in terms of looking at the roads, the health facilities. In Uganda, we have quite a number of health facilities, and an assessment was done in terms of trying to establish the levels of vulnerabilities of these facilities to climate-related hazards. Our health system provision, we have the national and specialized hospital facilities. Then at the regional level, we have regional referral hospitals. Then at the district, we have the general or district level hospitals. And then actually the last mile in our hospital delivery system is the village health team that is linked to the lowest unit of health. So these facilities are over the years have been subjected to various hazards in terms of rising water levels, in terms of floods, and so on. So, and it affects the delivery of sexual and reproductive health services. So our priority here is to make sure that the health system, the health infrastructures that we put in place are resilient to some of the climate hazards that we have identified that confronts us. Of course, the other idea, the other element we look at is the issue of monitoring and evaluation. We already have a national monitoring and evaluation strategy and framework. And just to bring us, we also currently implementing our third national development plan, which is the third out of 5 under our Vision 2040 framework. The National Development Plan clearly recognizes climate change as a cross-cutting issue, and that should be mainstreamed in all our interventions and all the programs that we are implementing. So that framework has a monitoring and evaluation system, but for the National Health Adaptation Plan, specifically, we want to make sure that we increase on the surveillance so that we are able to get that early warning, that signal, and respond appropriately. So for the purposes of this panel, I would want to say this is the journey thus far we have started. It started in COP26, that was held in UK. And I think this conversation in the last COP in Dubai, the issue of intersectionality between climate change, sexual and reproductive health came more and more openly. And I think the challenge is for us now to look at how do we implement and finance these innovative approaches. Thank you.
Thank you for sharing this, Omwa. Next up, we have Pamela. And while FP 2030 is global, you're focused on Latin America and the Caribbean. How does FP 2030 integrate climate into a strategy, and what are the specific intersections you see between SRHR and the climate crisis in the region? They also have a little bit of cartoon. Can you provide an example of an FP 2030 country commitment that addresses the resilience of communities and health systems, particularly sexual and reproductive health services and supplies in the context of the ongoing climate crisis?
Thank you, Garcia. Thank you for the invitation. Good afternoon, everyone. Buenas tardes. I'm grateful and honored to share this panel with these distinguished speakers and with Ambassador Noemi Espinoza. And thank you for all your effort this week. For a happy ending. Yeah. Finally, thank you very much. Appreciate this. It's clear that the current socioeconomic system underpinned by colonialism, patriarchy, and capitalism
are causing the ecological and climate crisis and failing to protect the most vulnerable and historically marginalized people. The current ambition to maintain status quo is failing all of us. More than 54 million women, girls, and young people are displaced and living in a humanitarian setting because of conflict, climate crisis, or other crises. Women are the ones primarily impacted by the climate crisis we mentioned here, and we are share this point. These displacements often occur in contexts where there is already existing fragility and insecurity, be it economic, social, cultural, and political. Therefore, any response must be grounded in comprehensive approach that address the complex realities women and girls live in. Access to quality reproductive health and family planning services contribute to climate change resilience and socioeconomic development through improved health and well-being of women and children. This includes increased access to education, gender equality, and economic status. And I want to do a pause about education to highlight the importance of comprehensive sexuality education as a key entry point to explicitly integrate climate justice into all areas of curriculum. CLC provides an opportunity for us to learn about bodily autonomy and integrity as part and parcel of the environment and context we live in, as well as related vulnerability. We all need to do better, from the climate community to women's rights and feminist movement, to center the interlinkage of gender and climate, in particular its long-lasting impact on women and girls. Gender and climate change are inherently linked, and thus women and girls must be part of the equation when developing adaptive strategy. The numbers are telling us a very worrisome story. Only 5% of multilateral climate funding goes to adaptation. Of that 5%, only 1% is allocated to health programs. And even a smaller amount of that money goes toward right-based family planning programming, education, and provision. However, access to comprehensive family planning is a key strategy for building resilient communities in the face of our changing climate and increased global disaster and conflict. In Family Planning 2030, we are aiming to respond to this by developing different pathways on family planning and climate crisis. Family planning is a global partnership centered on family planning, and we launched our updated emergency preparedness and response strategy in 2022. The strategy was expanded to include a new focus on resilience in health system, community, and individual levels. FP 2030 recognized the extreme threat posed by climate change to sexual and reproductive health as part of the strategy. FP 2030 engages funded partner base, including the environmental and climate change actors. Around 75% of current commitments have included preparedness and resilience building strategy in their engagement. Most already facing various humanitarian situations, long-lasting crises, and/or fragility, and climate change is an emerging issue for most countries and needs to be addressed to maintain access to sexual and reproductive health services during climate disasters. As you mentioned, I'm from Latin American Caribbean Hub, and this hub is new. We developed this hub last year. We have another hubs in Africa, share Europe and US, but we could present our third commitment last month, March, in Honduras, the state of Honduras, with the Vice Minister of Health, Brian Arasa, and Honduras have a strong commitment on provide information and model contraception and to decrease the mortality maternal. We are very proud, and this is our first step in the region. But we started 10 years later in Latin America with this hub. We have a strong region because we have a strong feminist movements, but we have many issues to work. Poverty has a woman's face. 1 in 4 girls get married before the age of 18. We live in a constant pandemic of gender-based violence and femicides. The reduction in maternal mortality rate has stagnated. The environmental impact shakes all of us, and we have the second highest rate of teenage pregnancies. And behind this data are human beings with dreams and hopes, but who are constantly exposed to violence, threat, and discrimination, and less opportunity to have a dignified life. To finalize, remember that ICPD changed the paradigm about population. We are not numbers, we are not percentage. We are people, we are human beings with human rights. Thank you.
Thank you, Pamela. And next up, I'd like to invite Nicole of YLabs. And YLabs has developed a climate psycho-reproductive health framework for funders and program implementers. What do we need to know as government actors, researchers, direct service providers, and funders, and how can we engage with this framework?
Thank you, Karaya. As a Top Council alum, I'm just delighted to be back at home with such an esteemed panelist. I'm so grateful for Ambassador Espinoza Madrid. Thank you for being here with us today. And thank you for your tireless work this week, especially. It is my honor to give a very brief overview of a framework that we developed in partnership with Organon, a women's healthcare company, to guide synergistic investments in the areas of climate action, gender equality, and SRHR. I'm also happy to give a very quick preview to the following work that is going to be supported also by Organon and the Bill and Melinda Gates Foundation. Next slide, please. So we have spoken at length today about how SRHR has been grossly overlooked in policy planning, research, and investment policy, so I'm not going to spend very much time talking about that. But I did want to use this opportunity to raise a really important point about climate and gender financing holistically. So in 2021, $600 billion, the B, was spent on climate financing globally, 2% of which integrated a gender lens. And in that same period, gender financing was also on the rise. So $2.6 billion was invested globally, and only $20 million in grant funding tackled both gender equality and climate change aims. You can imagine what percentage of that was earmarked for SRHR. Next slide, please. And I bring this up really because we cannot afford to continue with a business as usual approach any longer. The cost of inaction is just far too high. And we risk 3 main things. So 1, backsliding on the very important gender equality and SRHR gains that we have made as a sector to date. And by not taking a climate lens, we really risk misdiagnosing barriers to programmatic impact, not addressing the root causes that we're seeing here. And the third is that we fall into this cycle of reactive funding and programmatic initiatives every time a disaster hits, rather than focusing on proactive strategies that build adaptive capacity and long-term resilience. Next slide, please. So what can we all do to avoid this cycle? The first and the most important thing that we can do is to break down the silos that exist between climate and gender and health sectors. And we do this by making the connection between the climate impact on SRHR and advocating for these connections to be explored and addressed in policy, research, and programmatic initiatives. We can do this today with our current initiatives and our future investments. How do we get started? Next slide, please. Well, our climate and SRHR framework can help you do just that. It was designed to support both funding partners and implementers to assess the climate risks of their portfolios,
understand and monitor the dual impacts from both a climate and SRHR perspective, and move towards climate-proofing SRHR investments. Next slide, please. So let's take a look at what is in the framework to help you do that. The first is a digestible summary of evidence of the climate impacts to women's health. This is going to help you connect the dots between the two sectors. The second is that it provides guidance on how to assess opportunities and risks in your portfolio, helping you to climate-proof your investments. The third is it provides a whole database of examples of integrated investments in the climate, gender, and SRHR space, helping to understand where to direct future resources. And the fourth and most important is that it provides guidance on how to think differently about monitoring and evaluation. So I think one of my panelists already mentioned this is the evolving field need iterative, flexible approaches to monitoring impact in an evolving space. Next slide, please. So what's coming next? We have launched phase 2 of this work. We are really excited to work with Oregon and the Gates Foundation to develop a quantitative forecasting model that will assess the impact on certain SRHR indicators across different climate scenarios. We're looking at Pakistan, Ethiopia, Nigeria, and Francophone West Africa for our primary focus countries. We are also creating a landscape assessment of organizations who are actively working at this intersection and ripe for funding, and not a lot of funding either. So please connect with me afterwards if you're interested in learning more. And the third is that we're creating a set of donor briefs and convenings with our partner Panorama to promote cross-sectional learning and investments in this space. Next slide, please. The framework I mentioned is live. It is climatexsrh.org. Please go check it out, and I'm available to speak afterwards for any questions you may have.
Thank you. All right, so clearly this is a topic that we could talk for days about. And so we have just enough time for maybe one question from the audience for our panelists. Maybe one or two. So anyone who's got something to ask, Victor will run the microphone up to you. All right, any takers? All right, maybe I'll start off with a question about funding then, since we didn't get to that. So my question really is what do each of the panelists think? Very brief, like elevator pitch around what really needs funding here in the climate and SRHR space, and what are some of the main things that you would say to get some funding?
Yes, sir. So that's the big issue definitely in this area. There are two kinds of funding. One is climate and is health, where climate is kind of a small part or something like that. Although the big climate funders those are there, they are not funding the health aspect of climate effect of climate on health. But the other ones are slowly coming up. Although the big donors like USAID or FCDO, they are not up to the speed. They are coming up, they're not up to the speed. And there are other donors that we are finding who are interested. For example, I think I had a note somewhere, Rockefeller Foundation has committed $100 million for the cause. We have talked to some European donor and governments. They are interested into this intersectionality of climate and health. So yes, there's a lot of funding needed, and we need to really teach donor. Maybe we should proactively take the evidence to them, show them, so that they can start funding the.
Any other thoughts from the panel on funding?
Yeah, thank you. The issue of funding financing is quite a challenging one, but I would submit that we could start by looking at some of the budget neutral or interventions that we could do. For example, integrating some of these sexual and reproductive health issues into our planning and budgeting processes. I give an example. In Uganda, we have these programs that we fund in our plan, annual budget, but annually, for you to be allocated funds by the Ministry of Finance, you need to get a certificate of compliance that you have fulfilled certain climate-related issues that you want to integrate. So that's one of the strategies internally that I look at, but probably because the issue of the intersectionality between sexual and reproductive health and climate change is something that has come up, and I like the framework that has been shared here. I think we could leverage on that framework to make sure that we get more funding. But also let's explore the idea of corporate social responsibility. I think we can leverage some funding through corporate social responsibilities that we, depending on how we pitch that intersectionality and the outcomes at the community level. That's my humble proposal. Thank you.
I just wanted to add that a couple of things. So one, we always are asking for funding to go directly to feminist organizations who are working on this. So I think to fund those organizations to do this on-ground research, to bring more real, not real data, there's plenty of real data, but to bring the data so that it's understandable by those who need data and numbers to do the funding and the financing. The other thing I would say is that in the climate processes in the UNFPA, there are climate finance mechanisms. Some of them, like the Green Climate Fund, do have a strong gender equality requirement and framework. So one way is to build within those and make those more accessible to either smaller organizations or more accessible smaller amounts of funding so that it can go directly to what's needed now, including these health and climate linkages for adaptation, for resilience. And we also know that there's plenty of loss and damage from climate impacts, and we need funds to go to that. Things like the National Health Adaptation Plans can help.
Yeah, I'd like to add about it. It's necessary rethink about the power relation about funding between the donors and feminist movement, especially as small organizations, grassroots organizations. And we are in a table that we have different. We are not a multinational companies because we cannot have time or teams to all the processes that they ask, the accountability processes, and I think that's we need to have another kind of conversation and not opening, listening about what the movements want and what the people in the community needs, and not only think about from different offices that, okay, you have this and you do this. Now we need to have a more honest conversation about it.
Thank you. I'm just going to echo my fellow panelists in terms of the funding, so I'm not going to repeat that. But also the more research that UNFPA did also that showed that the national climate commitments, those that include gender responsive, are usually not, those responses are not well resourced. They don't have appropriate implementation plans, monitoring and accountability plans. So it's clear that we need this work. It's extremely important and we need to continue to push. In terms of the funding, again, I'm going to emphasize this because it's important to really ensure that the funding is getting to those that need it the most at the local level, at the grassroots level. And as we work and collaborate and partner with these communities, really ensure that they know where these funds are and that we can support them in order to get access to these funds. Thank you.
Thank you so much.
I'm called Stella. I'm from Uganda. I have a tough question, not only for the panelists, but for all of us. I'm finding that development partners, donors, are shying away from working with government agencies. And for me, this is, I don't know, yes, we do need to hold government accountable, but many times the development partners are actually working with civil society, and you cannot expect civil society to coordinate government. Mm-hmm. It has to be the other way around. So unless we rethink the way in which we are going to work through the governments that should be accountable, I think we may be hitting a stalemate. So I wanted, I don't know if that was a question, but I wanted to put it out there. Thank you very much.
Thank you. Sure, and I think we only have time for one response to this last question. But Ambassador Espinoza, it's a real honor to have you here at the Population Council, and thank you so much for joining us today. We would like your take on how we should collectively position this issue at the intersection of SRHR and climate justice for the upcoming summit of the future.
Thank you very much for that question. Yes, I think, we're in a complex intergovernmental space, and I'm very happy that we achieved a political declaration on the first day, so we had a happy start. But it's not, as detailed as some of us would have wanted it to be. But I think by reaffirming the ICPD program of action, we're reaffirming everything, right? Including climate issues or all the issues that are in the ICPD. So given this environment, I think we should focus on making sure that we keep the ground. Unfortunately, we have to protect the ground that we have made. I mean, the negotiations for the Pact of the Future are extensive, and they are, we're waiting for the second draft, but the first draft was at 250 pages. But I do think that this is an issue that does require relevance, and from the common talking points, there is a lot of convergence around what those issues are. So I think focusing on those opportunities, on those things that we think are lacking, that should be included, that's what we should do. But also not undermine that if we're reaffirming things like the ICPD, it's a big win. It is a big win. Governments in the political declaration pledged to accelerate action in the implementation of the ICPD. It's in one of the paragraphs, I don't remember anymore, but maybe 6 or 7, they changed a lot, the numbers. So just because it's not spelled out, it doesn't mean it's not there.
Thank you. Thanks everyone for your thoughtful remarks, questions, and as a philanthropy advisor, I sit in the middle ground between all of you doing this great work and our funders. So this closing remark is going to sound, I think, repetitive of what we all have just heard. But as we move to consider our discussion for today, I'd like to share an additional plug for the donor and funding community to just place as much emphasis as we are requesting our partner organizations, NGOs, CSOs, and governments to not only consider the intersections between sexual reproductive health and rights and the climate crisis, but also follow through and shift our funding behaviors and approaches to align with those considerations. Now, this doesn't mean change your portfolio overnight, but one of the exciting pieces of my work has been witnessing and encouraging more formal and informal connections with donors whose interest areas orbit around each other. Formally, this can look like engaging donors. Informally, this can look like facilitating more connections with donors whose interest areas orbit around each other. And formally, this can look like engaging with donor collaboratives and coalitions like the Hive Fund for Climate and Gender Justice and the SRHR Climate Justice Coalition that Eleanor spoke about earlier today. And being quite frank, the climate crisis impacts all of the work that any of us are doing in ways that are already tracked, documented, and have been shared with us today, and in ways that we haven't yet experienced. So I personally am coming away from today's conversation with the understanding that every actor within this ecosystem needs to consider the nexus of SRHR and climate justice moving forward, as the impacts are detrimental and can't be solved with siloed thinking. And with that, I would like to thank all of our speakers and panelists for today, Ambassador Espinoza Madrid and Silva for their opening remarks. Okay.
Our panelists, Pamela, Mr. Omwa, Patricia, and Rajib. Our presenters, Eleanor and Nicole. And our convening organizations, Panorama Global, the Population Council, Women Deliver, and YLabs. So I think this concludes our discussion for today. I believe there's like likes and questions out there for those that want to connect further. Thank you.